Hello, my name is Amir Rashid. So in this video, I'm going to be talking to you about how to provide a first aid to a person who is having a stroke. Now, first of all, what is a stroke? So a stroke, or also sometimes called a brain attack, occurs when there is an interference with the normal blood circulation in the brain. It is usually caused by a clot that has been lodged in the cerebral vessel or by a blood vessel that has ruptured. A person who has experienced a stroke will usually develop weakness or paralysis on one side of their body, and the patient may also become unresponsive or have a seizure. Okay, so now I'm going to show you the first aid which we need to provide for a patient who experience a stroke. First of all, we must maintain the airway of the patient. Now, this can be done by positioning the head of the patient like this. I'm sorry if you can see. So usually a person who has stroke usually would be like this. So we position the airway by lifting up their head like this, pushing up the chin so that their airway can be open like this. Okay, so position the head like this. So first we have to maintain the airway of the patient. Next, after positioning and of the maintaining of the airway of the patient, then we have to provide a mask to mouth breathing as needed. So I don't have the mask apparatus, so I'm just going to use this mask here. So you place the mask and cover the mouth and nose of the patient. Done. And then you will breathe into it with it. Make sure the person who had stroke, if you notice any fluid in their mouth, then we should position the patient on their side so that the fluid can drain out of their mouth. Lastly, we should maintain the body temperature of the person to a normal body temperature, and we should ensure that the patient or the person here keeps quiet until help arrives. And that is it for my first aid for a person who is experiencing a stroke. Thank you.